Well, new daily confirmed cases per million, and as we know, Europe is well into a second wave. France very high, Poland on an upward trajectory, definitely. Italy, which had done so well, now overtaken the UK, and the United States. The line is going up steeply. Now, the United States had been like a couple of weeks behind the UK. Well, now it's caught up, and it looks like it's going to overtake the UK, unfortunately, in terms of these new cases. Germany not so bad. Canada and Germany, though, the numbers are still increasing, and the potential for more rapid increases is always there. So that's a rough overview of where we are. Welcome, of course, to this video. Just a bit of a brief update about the United States, then focusing on some topics that are going to apply everywhere. So let's look at the overall data for the States. Now, we see that the total cases are basically reaching a million, 10 million are the total cases. A rapid increase, and the deaths, of course, keep going up. Over 1,000 new deaths in the last 24 hours. And again, we see the northern states, including Alaska, particularly badly affected. So the northern states, typically where there's less sunshine now, typically an increase in cases. Still increases in the southern states, of course, but not so bad in California. So that's encouraging. Now, in terms of trends in the United States, and of course this is what didn't work last time. There we go. CDC works this time. But seriously, I mean, the increase in cases, daily trends in numbers of COVID-19 cases in the United States reported to CDC. There is a significant increase, of course. And if we go down, we actually get the daily increases, and we can see it's been well over 100,000 new cases per day for those 3-day period. Right, so definitely increasing numbers in the United States, but the deaths aren't increasing in tandem with that. The deaths are increasing slowly, and we are going to see increase in deaths, of course, but sadly it's inevitable. This horrible phrase, baked in. So slight increase in deaths there, but that is going to increase, unfortunately, as fall with autumn time progresses. Now, some things I want to mention that are really quite important now. So that's the United States. Now, Newark and Chicago. There are flights pretty well daily from Copenhagen to Newark and Chicago. And I've done an internet search this morning, and I've looked at some news outlets, and I can't see that the United States are yet taking particular precautions against flights from Denmark. This really has to be done. Now, if I've missed something, do let me know. But as far as I can see, flights to New Jersey and Chicago, New Jersey, Chicago, Illinois, are still flying. And of course, Newark is basically New York, isn't it? Huge urban areas. Concerning that the mutation from Denmark could spread to those areas, really that is something that needs clamped down on several days ago. We first flagged it up about 3-4 days ago now on this channel. Now, if I'm wrong, sorry about that, but that's I did have a good look around, and I couldn't see that the United States have banned the flights yet. So definitely needs done. We don't want this mutation in the United States. Oregon Department of Agriculture and Oregon health authorities have been warned by the Biological Diversity Society, or strongly advised by the Biological Diversity Society, to re-look at the mink outbreaks in the United States. Now, just to emphasise, we know there's been this so-called cluster 5 mutation in Denmark. We don't know, and as far as we know, there is not vaccine resistant or potentially vaccine resistant mutations in the mink population in the United States. But is that because we haven't looked hard enough? Well, that's what the Biological Diversity Society is suggesting. But I do want to stress we don't know of any at the moment. this is a theoretical risk, but certainly a potential risk which should be re-looked at. We need genome sequencing of the mink cases and of mink workers in these mink areas in the States, as I go on to the wrong screen again. So Oregon, for example, there's 11 registered factory farms for minks. Don't know why you, like me, to use the phrase, would not be seen dead wearing an animal fur. It's quite unthinkable. I assume they're mostly exported to China and Hong Kong. Do let me know. I mean, in the UK, for a man or a woman to wear mink or a real fur coat would be completely socially unacceptable. It would be you just wouldn't. It's just unthinkable that anyone would do that now in the UK, and I think that's much the same all over Europe. Do let me know what the situation is in the States. So I think they're probably mostly exported to China and Hong Kong, which are lucrative markets. Unfortunately, where the culture has not yet moved onto our more, what I would describe as a more progressive, enlightened culture. Now, there's 11 registered farms there. There's probably many others that aren't registered as well. So this is a risk that's been perhaps not investigated by the US authorities as well as it should have been, because of the greater likelihood of mutation in other species. When that transfers to man zoonotically, the spillover infection, the risk of mutation is much, much higher as the viruses seek to adapt to the different molecular architecture in different animals. Wisconsin, there's been 3,400 minks found dead, as far as I understand this report. Do check it out for yourself. It's all there from the Biological Diversity Society. So the minks themselves have been dying from SARS coronavirus 2. The question is, how is it mutated in the population of minks in the United States? Just to stress, the only vaccine or potentially vaccine resistant mutation we know of is the Danish one, but that's probably because we don't know. We simply don't know. We need to find out, and I'm sure the CDC will be moving on that pretty quickly now. They have been alerted to that well and truly. Now, Jonathan Van Tam, our Deputy Chief Medical Officer, issued... now, this is an internal NHS report, so you can't get it, but it's in lots of popular news outlets. It's been leaked. All UK hospitals ordered to isolate new mutation. Immediate action. Note the word ordered. This is not... they have been ordered to do this. There is no suggestions here. This is a direct order from the Deputy Chief Medical Officer, and will be obeyed. Patients from Denmark must be isolated, treated in special centres, and the genomes must be sequenced. Now, cluster 5 is the one we're worried about. Only 12 known cases, 8 directly from mink workers, 4 presumed to be from community spread. How many more is there? Hopefully none, but we simply don't know. And the UK authorities are taking this very seriously. Chief medical officers don't give orders that often. They're taking this seriously. Passenger planes, ships, lorries carrying freight from Denmark will not be allowed across the border. They're just banned. No Danish bacon for a while. Anyone who travelled to Denmark within the last 2 weeks are not allowed routine outpatient, ambulatory or primary care. Special arrangements have to be made. Good. Anyone who needs urgent hospital treatment should be separated from other patients and managed in strict isolation in a single room with ensuite toilet facilities. Trouble is, we haven't got too many of these rooms. They're in short supply. But that's an order from the Chief Medical Officer, so it's going to have to be facilitated. If a person subsequently tests positive for COVID-19 who's been to Denmark, immediately transfer to Specialised Infection Diseases Centre, as we isolated people back in January, February, March when we had the first, January, February when we had the first cases in the UK. Whole genome sequence must be carried out at Colindale, which is the Public Health Labs in Colindale. I think it's near Henley. It's a London area anyway. So they'll go there for centralised testing. And the last 14 days there's been 300 and 500 arrivals from Denmark in the UK. Now, Denmark a few days ago isolated the most at-risk areas. How much the virus had spread before then, we don't know. It could well have been spreading from late September all the way through October. This is what the British authorities are worried about. And to tell you the truth, I am... the reason I'm going on about this, I don't want to be alarmist, but it is concerning. If this is a new mutation to which the antibodies don't work, then it may be, we simply don't know yet, it may be that the T cells don't work either. So people could be reinfected with it. No cases yet, we don't know. But the possibility of one vaccine. So far on this channel we've always said that one vaccine will do for all cases in the world, and that's been true up until this new mutation. And that could alter that. Now, we could certainly make a new vaccine for that new mutation, but the point that it's mutated in animals means that it could happen again. Has it happened in the United States, for example, where there's been outbreaks on mink farms or associated with mink? The potential for this is significant. I hope I'm here in a couple of weeks' time or a month's time. I really hope so, and I just say, oh, that mink mutation, complete false alarm. Nothing happened. Now, if that's the case, fine. Basically, we've disrupted our supplies of Danish bacon for a while. You know, we can live with that. We can have eggs without bacon for a little while. So much better to err on the side of caution, as I'm pleased to say the UK authorities are doing. But because flights from Copenhagen are going all around the world, you know, to the Middle East, for example, they're still flying into the Middle East. The States, different places in Europe, UK and Germany now banned. But the mutation could go to the UK via the Middle East, of course, easily. Via there's a flight to Newark, New Jersey. It could go from Newark, New Jersey into New York back to the UK. You know, we are as strong as the weakest link here, really. And the fact that the flights have not been banned from Denmark is just incredible. And again, the World Health Organization haven't stood up and said, I think we should stop all flights. They have commented, as we looked at yesterday, but you know, we said this at the start of this pandemic, we need to move from reactivity to proactivity. Right, you understand my thinking, I think. New coronavirus cases linked to mink have been found in Italy, Netherlands and Spain. So again, we need to go back and genome sequence these and check how they react with antibodies. Mink farming in Britain ended about, I think it was outlawed about 2002-ish, something like that. But there are an estimated 112,000 feral mink in the UK, which is a bit of a nuisance because they've eaten all our water voles, which are beautiful creatures like water voles, like Ratty in Wind in the Willows. It wasn't a rat at all, it was a water vole, but I think the minks have eaten most of those because obviously they become established as feral animals, which is a pity. And of course the history of ecology is replete with such disasters. Rats on Pacific islands that eradicate local bird populations that have been there for millions of years, and numerous other examples of introducing species. Or think about Florida with the introduction of Burmese pythons. They had some Burmese pythons in Florida. Then there was a storm and just a few of them escaped. And now they're all over the Everglades and they're eating all the beautiful natural Florida birds. And you know they are euthanized if they're found, but of course they're so well adapted. So Burmese pythons are all over the place now in Florida, and they're not supposed to be there. They're adapted to the ecosystem in Burma, but they're not adapted to the ecosystem in Florida. So they're raising havoc. Introduced species. We mess with ecology at our peril, and mass farming is messing with our ecology. Capturing wild animals to exploit them for food, which we don't really need in the first place, is messing with our ecology, which is why we have this pandemic, of course. Well, one of the reasons we have it. Anyway, you understand my thinking there. Professor Fiona Matthews, Mammal Society, Senior ecological scientist in the UK. There's a chance it might have jumped to cousins of the mink like otters, ferrets. We know the virus came from animals. It would be foolish not to look at whether it's already here. And of course, there's a small chance that it might pose a risk to humans. Well, I'd say it's slightly bigger than a small chance, Professor, but I understand you're being cautious. We don't want these new coronaviruses to become endemic in wildlife, because then they could be bouncing from wildlife to humans every year, and we don't want that. Right, okay. Let's go on to a better news story. And we do have a couple. Free supplies of vitamin D in the UK. So Scotland started. Now in England, we are to deliver 2.2 million people with free vitamin D from December for 4 months, 4 months supply, to be delivered directly. All vulnerable people, 2.2 million of them, care homes, people with significant comorbidities that were guarding, all to be issued with free supplies of vitamin D. Now, as of yet, the government don't seem to have released the dose, but the free supplies are there, which is pretty good news. There I am. Right. So Boris Johnson, the Prime Minister, we are indeed looking at the possible beneficial effects of vitamin D. We'll be updating the House shortly. God, you know, it's November. I started talking about this in, go to the right screen. I started talking about this in January. 10 months later, all of the problems that could have arisen as a result of lack of vitamin D. Anyway, the penny is dropping, as we say in England and Scotland and Ireland and Wales. Right, he is entirely right to look at that. We'll see who he is in a minute. He is entirely right that we need to look at the beneficial effects of vitamin D. Government expected to commission clinical trials. So as we do this, we might as well trial the data at the same time, which would be good. National Institute for Clinical Excellence in June poo-pooed the whole idea. So well and truly poo-pooed in June. Now the spirit has moved and things seem to be happening. So excellent news. Matt Hancock, I've asked scientists to look again at the impact of vitamin D on resistance and immunity. Good. Thank you, Matt. Better late than never. There's been some updated evidence. Well, this is his fig leaf saying there's new evidence. In fact, we've had the evidence for months. But at least he's doing it, so all credit to him for doing it. The he that Boris Johnson was talking to is David Davis, who is the politician who's been advocating this. So all credit to Mr. Davis. The Scottish Government, this direct quotes, are sending 4 months supply of vitamin D to everyone who's shielded in Scotland. Well done, Scottish Government, for being proactive. Given that it's low cost and there's no medical downside, according to Mr. Davis, will our government consider the same approach in England? Good. Good news. Now, COVID symptom tracker app that the BBC seem to be trying to keep quiet. Let's have a quick look at the screen. Now, this number's down. North, of course, high. Wales, high. Lower in the south of England, number of cases. Peruse for yourself. But look at the shape of this. This is excellent news. So actually, the number of people actually infected is going down. That's the main thing I wanted to show you from that, I think. Yeah. So very, very encouraging graphic. So get your mobile phone out. Look for that app, COVID Symptom Tracker app. Download it, fill it out every day. What's the big deal? Why don't the BBC run this advert that I've just run? Why don't they do that? National broadcaster seem to be hushing it up. Wonder why they would do that. Anyway, are we over the wave? Over the peak of the second wave is hopeful. Now, over 1 million reports based on 13,000 positive antigen tests. So good data from the COVID Symptom Tracker app. Overall figures in the UK are starting to fall. 2 weeks up to the 1st of November, new cases were 42,000, down from the week before 43,000. Now they are 37,000, as we've just seen. We just saw the live data there from that dot, which each dot is a day. This is the number of people with it, of course, at any one time. So number of new cases, though, going down, but the total number of people with the infection at any one time also heading down the way. So, encouraging. The effects are working, and the effects we're seeing now, of course, because of the lag effects, are because of the like tiered response we had before with the enhanced lockdown. This should be accelerated more, but there are provisos, as we'll see. So looking good there. I mean, still high, still very high, but the trend is somewhat encouraging. North of England and Scotland, new daily cases have fallen in the last week. Good. South East and South West, daily new cases rising slowly, but continue to be much lower than other regions in the UK. From Tim Spector. Now, the R value in the UK is now considered to be 1.0. So it's been quite a bit higher, so that's good. A bit lower in Scotland, as you see. England and Wales about the same. Infections have stopped increasing in almost all ages. Modest increase in the over 60s, which is, of course, a concern, because this will feed through to hospitalisations. So Tim Spector has said the worst affected areas have shown the most improvement, but large differences between regions remain, as we've seen. The data from the COVID symptom tracker app is 2 weeks ahead of hospital data and 4 weeks ahead of most deaths. We urge everyone to respect the regulations, of course. Now, I think we can probably see that. Yeah, so here we have the official UK data. And we can now make predictions about this, given the very up-to-date data from the COVID symptom tracker app. So we would expect this line here to flatten off now. Probably a better view from that. Cases by date reported. In fact, it is starting to level off. So that is encouraging. And of course, but we need the R to be below 1 for the numbers to go down. So we are flat now, pretty well nationally flat now. So it's moderately encouraging, but we're still at high numbers. There's still a lot of new cases, of course. This is not over by any means. And what is concerning is the healthcare situation. That's patients admitted to hospital, 1,600. Currently, nearly 13,000 patients in hospital. That number there is since the start of the pandemic. So the patients in hospital, now this is concerning, but we would expect these numbers to start going down in about a week or two. Because as the COVID symptom tracker app says, there's a 2-week delay in hospitalisations and a 4-week delay in deaths. So, but having said that, these numbers are really quite high. Even the number at the peak was only just under 20,000 at the peak. So we can expect these to go up maybe for another few days, but then they should start flattening off, and whether they go down or not depends on what we do, of course. Do check on those links for yourself, obviously. Now, one of the concerns is one of the SAGE members, Mark Woolhouse, Professor at Edinburgh and SAGE member, Scientific Advisory Group for Emergencies. We said we're missing 50% of cases. Now, that means that 50% of people, of course, who are infected are spreading the disease. Now, given that we're flattened out now, just think how much better we will be doing if we were catching everyone. Because the point is these people are not self-isolating, so this 50% we're missing are the ones that are spreading the infection, clearly, if they're not self-isolating. So they're not self-isolating. Now, it could be because they're mild or asymptomatic, understandable. We need a high index of suspicion for the features. Again, the COVID symptom tracker app goes through that in great detail, and it tells you how likely your symptoms are to be COVID or not, even if they're very mild. So even if you've got a cold, put the symptoms in, and the app will give you advice. Some people are mild or asymptomatic. Some are symptomatic but genuinely don't realise they have it. That's why we have this high index of suspicion, and some having symptoms but actually ignore them. Maybe they want to go to work. Maybe they need to make money. Maybe they don't want to be locked down for a fortnight. This is a problem. So this one is, these two we need a high index of suspicion. And we need to use the symptom tracker app to give us, adjudicate the probability and indicate the need for a test. This one you can only describe as malicious. Some people are essentially deliberately spreading the virus. That's an attitudinal problem. And I'm not quite sure what you do about that. I guess we have to support each other to obey the rules. You know, if someone says, I'll just come round for a cup of tea, no, we're not household mixing. But some people realise they have probable COVID symptoms and don't self-isolate. That is a big problem. And of course an immensely sad reflection on our countrymen. Just while I'm talking about that, in fact we'll mention here, so Liverpool is to try and flag everyone up. Now my absolute admiration for the people of Liverpool who've turned out for this mass testing in huge numbers. You know, I can't imagine there's many people in Liverpool now haven't been tested. Everyone's getting tested as this sort of a trial thing to see how many people are infected, and the people of Liverpool are going with that very, very well. And I haven't covered the process in detail, but obviously as soon as the results come out, we'll be looking at that with great interest, because Liverpool, of course, was the high risk area, and it was in a high risk. It was in tier 3 even before the lockdown. But the people of Liverpool turning out by the tens of thousands to be tested. So I just found it really quite, it's quite emotional seeing everyone working together like that. I just thought it was wonderful. So well done. And I think that'll probably do us for today. Concerns and signs of hope. I think that kind of summarises this video. Anyway, thank you very much for watching, as always.